Okay, we're going to go straight to the Prime Minister, who is speaking right now on the healthcare deal between the federal government and Ontario, as well as the Atlantic provinces.
A lot of the questions around affordability, a lot of questions around the tough moments that young people, indeed all Canadians, are facing right now, with inflation on its way down but still high, with interest rates having an impact, with the geopolitical challenges, whether it's the impacts of the war in Ukraine or supply chain disruptions that continues. People are facing tough times, and that's why as a government we've stepped up in our supports for students, but we're also making sure we're delivering targeted supports to people as they need it. One of the things that people are talking about a lot, not just this morning, but across the country, is the need for better results in our healthcare systems. That's why a few weeks ago we sat down to offer the provinces close to $200 billion worth of investments if they were ready to move forward in 4 targeted areas that will improve the outcomes and results for Canadians of the new investments in healthcare. Specifically, better access to family doctors, making sure that we're monitoring how many more Canadians every year have access to family care doctors and primary care teams. Moving forward on better supports for frontline health workers, making sure we're moving faster on credential recognition and licensing, making sure we're reducing the backlogs of surgeries, making sure that we're supporting people who are increasingly getting burned out after some long years of pandemic and continued strains on our healthcare systems. Moving forward on better mental health supports for young people, for all Canadians. We know that mental health challenges continue to be a significant challenge for Canadians who are facing challenges since the pandemic and before, whether it's increases in anxiety, increase in various mental health challenges. We need a system that's going to be able to respond in a timely way and give them those supports. And finally, we need modern healthcare systems that are grounded in better data collection, better information sharing that's going to allow us to have the best possible care for Canadians right across the country and ensure that Canadians are receiving the best possible care across the country by being able to understand and quantify exactly what's going on across the country. These are the things that we're focused on, and quite frankly, the news today that all 4 Atlantic provinces plus Ontario have signed on memorandums of understandings to start the negotiations right now on how we're going to deliver these better outcomes for Canadians are great news. When we made the healthcare announcement and we had the meeting with the First Ministers a few weeks ago, I said we were going to get moving forward on negotiations within weeks, not months, and that's exactly what we're doing. I can also highlight that there's many other jurisdictions, provinces across the country that are interested in starting the important work of delivering better results for Canadians. But I do want to take a moment to thank the premiers of Nova Scotia, New Brunswick, Prince Edward Island, Newfoundland and Labrador, and Ontario for being leaders in stepping up and starting to really improve healthcare systems for their citizens at a time of crisis.